Since you are working for a global entity cut across through many countries around the world, how do the world perceive us as a country which is bankrupt? Uh, what is the story out there?
Yeah, I think over the last 20 years, if you take the top 10 companies in pharmaceuticals, 7 companies we had multinational companies. Then maybe 2 or 3 Indian or regional countries. So it was Indian basically. Now the shift has taken place. Out of the top 10 companies, probably about 7 is Indian, right? So the dominance of India, because India is a it's a pharmacy of the world, you call it. Internationally it is known as pharmacy of the world, because they have so much capacity and capability. And so India, so initially we had difficulties in convincing the partners, but the regional countries see Sri Lanka as a friendly nation, see Sri Lanka as may not be the biggest market in the region, but it is a very potential market for most people, right? Most companies from India, Bangladesh and Pakistan and Indonesia, because these are the 3-4 regional countries associated with Sri Lanka. And the perception about Sri Lanka, they had a feeling that, okay, you guys, being a small country, if you do the right things, you will bounce back. And that was our communication to them as well. So look here, we are a nation, a resilient nation, right? So going back in history, how we bounced back, also giving them confidence and reassurance that, this is a country that has a lot of substance, to work with. And I think that is very well established.
Good evening, everyone, and welcome to yet another MBA Diary session. I would like to warmly welcome our guest speaker today and our students, as well as our alumni and industry partners. So to begin today's session, I will hand over to Dr. Rohantha to formally introduce our guest speaker.
Thank you very much, Ruth. And I got an amazing personality today. He's been in the pharmaceutical industry since 1994, which is almost 30 years of experience in this sector, which includes a stint of 3 years in the Southeast African region. He has held many leadership positions throughout his career, like country manager of Reddy Laboratories Limited, East Africa, then in Sri Lanka for DRL, then managing director of Emma Chemi NB Ceylon Limited, and of course he joined Cipla 7 years back, presently working as the managing director and CEO of Cipla, the leading transnational pharmaceutical company. He has built a reputation over the years as a people's development expert. He has helped to produce many of the leading industry, both locally and internationally. He's a gold member of Glaser Kennedy Insiders Circle USA since 2011, a great learning and networking platform. Mr. Jaward is also the vice president of the Sri Lanka Chamber of the Pharmaceutical Industry of Sri Lanka. Ladies and gentlemen, please, it's with a lot of honor that I invite Azam Jaward, MD CEO, Cipla Limited, Sri Lanka. Azam, over to you.
Thanks, Dr. Rohantha. So thank you for those kind introduction. I consider this as a great opportunity also to speak to people like you all. That's my passion, actually. So within the organization, wherever I worked, I created a leadership development platform to speak to individuals, engage with them, try and, help them. I'm not exaggerating. Probably, I would have touched about, 1,000 individuals, some way or the other, because that's my passion. And so I enjoy speaking to people, enjoy engaging with people, and also try to understand what is that, they have as a dream, and so what they are trying to achieve in their life. So that really, it's a mutual learning actually. So I also learn when you engage with people. So that's something that I've been throughout doing, and so that gives me a lot of satisfaction and fulfillment. So today also, I think it's going to be a similar engagement with you all. So I'll see, so I'm going to be with you all for 30-40 minutes. I'll see how much value addition that I can bring in your careers. So first and foremost, I've been doing some research on Staffordshire, University. So congratulations, I think you're in the right platform. This university has been ranked, one among the top 100. I think the last 3-4 years, it is improving their ranks, so which is a good sign, and which is going to be very good for you all. And I see, this type of platforms, it's learning from experience. So today, what I'm going to do is I'm going to put it in 3 buckets. First, I will, briefly speak about what Cipla Global is. And then I will also speak about, Cipla journey locally, what we are and what we are doing and what we are going to do. And I will also, try and see how I can add value in the, third piece, so I will try and, see how I can facilitate or, add value to you all. So to begin with, let me speak about Cipla, what Cipla is. Actually, Cipla is a global pharmaceutical company based out of Mumbai, India, which has a rich history and tradition, more than 85 years of experience in this industry. It's a global giant, you may call it. And the purpose of Cipla is, caring for life. So generally, the purpose or the motto, generally people keep it, for the hearsay. So for the namesake, it will be there, but it's not being practiced. But what we talk about Cipla here, caring for life, true to the word, it is being practiced by top to bottom. That gives, every employee the additional pride, to work for a company like Cipla. Cipla is, synonymous in when it comes to quality, affordability, accessibility. All these, factors are being covered, and it is, playing an integral part in any healthcare ecosystem because of its wide range of products. So therefore, it's a great company to work for. It's not because I work for Cipla, I say that it is a great company. It is definitely a great company. I got really impressed by Cipla's initiative is that when I went for my induction, I saw Cipla is the only pharmaceutical company which has a hospital, right? Mainly driven by for the patients. They are treating the patients free of cost. Palliative care hospital. So when I say palliative care, what it is, it's in the in life when people have given up hopes on the patient, particularly when a doctor says, this patient will live only for 3 months, 6 months, or 1 year for that matter, right? So then what happens, caretakers, caregivers, and the patients give up hope on the patient. And that's a very, very tough situation to be in. And it feels miserable. So what Cipla did is, to create, give that, end of life, quality quality of life for those patients, they created a palliative care hospital in Pune, which is close to Mumbai. So what they do is, so they come and they bring the patient, caregiver, caretaker, and train the caregiver and caretaker, and release the patient. And a team of doctors will go to the respective residents and do the follow-up. So they have been doing it, and they have seen the success of it, and they also expand. So in order to cater more patients, so they do that. So why I said about this is to give you a perspective of in what angle the company is thinking. So so of course I can keep talking about Cipla Global, because it has created so many milestone achievements, patient-centric achievements, which is worthwhile talking. But due to time limitations, I will skip to the second piece that I told, what Cipla Sri Lanka is doing. So Cipla Sri Lanka, I think early 90s we started, and started as an Indian generic pharmaceutical company. And eventually, so we grew over the years. And in 2015, we changed the business model. Cipla wanted to, take the front end to under Cipla. We call it direct to market, DTM. And that's when, so a lot of things started changing for Cipla. Today, we are the leaders. We are number one in respiratory products, as in, you will see these inhalers, so we have all inhalers to treat COPD, asthma, in childhood asthma, so entire respiratory portfolio is there. So we are number 2 in cardio. We are number 1 in Euro. So we are a leading pharmaceutical company. And in the last during COVID, we made a big difference in the patients' welfare. We did a lot of work in educating patients, in supplying medicines, despite all the challenges. And we also donated, quite a few pharmaceutical products to the health sector of Sri Lanka. So leaving that aside, for an MBA, what learnings that I can bring for you all in your individual responsibilities. So I just got a feedback from Rohanta before we started about the audience. So he said about all working class and maybe leading senior managers, and from marketing to apparel to everyone. So my thought process then, I thought maybe I will try and add value here. So what brought Cipla here where we are is, number one is the culture, the leadership culture we brought in, and we made. Of course, we were very different from how other companies are operating. So we wanted to get the right people. Number one, recruitment is something that we consciously worked on. We have to recruit people who will go with the value system of the company, who will go with who has the inclination of the purpose that you are driving. So then what will happen is, your life will become that much easy, and you will be able to sail through very nicely without, with a purpose. The other thing that I would want to highlight here is about the leadership culture that you are inculcating. Basically, in Sri Lankan context, if you see, the leadership, how it evolved over a period of time. Actually, political influence also had in leadership, but that actually did not or will not make an impact, in the corporate or private sector. So what is important is that, global leadership styles that, we have to, inculcate. And that is something that we wanted to bring in, bringing in the empathy, bringing in, the mindset of, try to understand the other side, so that really helped. And, so people eventually learned over a period of time. And whenever we have opportunities, we don't recruit people from outside. When you don't have internal talent to fit the bill, only we go out, but it's all homegrown talent that we give opportunities to. So actually that really helped, and that is working for us. Then we are a preferred partner for all stakeholders, whether it is our distributor, whether it is our pharmacy chain, whether it is our doctor associations and the groups, because for doctor association and groups, we brought science and we became the knowledge partner for them, and that has been very well appreciated and very well. I think that partnership really worked. So over a period of time, we were able to contribute significantly in upgrading or bringing the standards of medical treatment, and also the awareness piece. So there had been a lot of awareness gaps, disease awareness, and medications, how to use them and all that. So we have been having a dedicated team to drive that message across. So that was very well received and very well accepted by the medical fraternity. Our support that we get from India, basically, as you guys know, India is evolving superpower when it comes to pharmaceuticals or when it comes to healthcare. Also, so they stand up very, they are up there. And we have been able to bring the best of class practices, and we have been able to bring the best of the doctors, to educate the local medical fraternity. So therefore, so it really helped, overall. So, Rohant, I think I've been talking, it's all one-sided. What I would suggest is, let me stop for a moment and let me take some questions, and then, so probably I will try and, build on from there on. Is that sounds like a plan?
Thanks so much, Azam. Can you hear me?
Yes.
Hi. So many questions coming on to my WhatsApp message. I will feed you with some questions. I will coordinate together and club it.
Yeah.
The first question is coming is, what are the key challenges you are seeing in the pharmaceutical industry in Sri Lanka?
See, key challenges, one of the key challenge that we have been having in the recent past is that availability of foreign currency for importation. So that had been one of the biggest concern and constraint that we had. But the Indian credit line really helped. And right now, I don't see that as a major challenge. But the major challenge going forward is the cost-effective products. So at the moment, cost is becoming a major issue, concern. Now we are an industry which has about 85%. We depend on imports. So if the dollar rates, fluctuates or go further depreciates, our cost of medicine is going to go up. Then the patient, so consume, see more than 60% of the business patients are from the government sector. So therefore, so that becomes an issue. And then, when we have Sri Lanka downgraded by Fitch rating or any banks for that matter, the global partners who wants to do business with Sri Lanka there can be questions raised there. So therefore, the best thing would be to whatever we can manufacture locally, the local manufacturers have to step up, to bridge that gap. But still, now 15% locally manufactured, 85% still import based. So maybe we can increase the number of players and the local manufacturing so that we can reduce the dependency on imports.
Some second question going. Could you tell us what are the key challenges which are there in the distribution network of Sri Lanka, given the kinds of issues that we have had from the East attacks to COVID-19 and now so many challenges with regard to the liquidity in the marketplace?
See, one of the biggest challenge that we had, the supply shocks that we had. Not after the East attack in particular, but during COVID, the supply shocks was kind of, very, it was really challenging. And subsequently, we had this economic crisis also that also contributed significantly. So when it comes to, you see, once it is being imported, distribution, there were not major challenges because, we are operating in a very small country. So therefore, from point A to point B, there was no major, crisis situation. So I don't foresee that as a challenge. As long as supplies are there, distribution is not a major problem, because I think we have sufficient distributors and also the processors that we have in place, because some of the distribution, they have a norm within 72 hours, so they have to deliver any part of the country. So that is possible and people are working on that. So I don't see that as a challenge. But supply, as long as supply is established, then so distribution is not a major problem.
Azam, there's a nice question coming up. The guy is saying, since you are working for a global entity cut across through many countries around the world, how do the world perceive us as a country which is bankrupt? What is the story out there?
Yeah, I think over the last 20 years, if you see, if you take the top 10 companies in pharmaceuticals, 7 companies we had multinational companies. Then maybe 2 or 3 Indian or regional countries. So it was Indian basically. Now the shift has taken place. Out of the top 10 companies, probably about 7 is Indian, right? So the dominance of India, because India is a pharmacy, it's a pharmacy of the world, you call it. Internationally it is known as pharmacy of the world, because they have so much capacity and capability. And so India, so initially we had difficulties in convincing the partners, but the regional countries see Sri Lanka as a friendly nation. See Sri Lanka as the, we may not be the biggest market in the region, but it is a very potential market for most people, right? Most companies from India, Bangladesh and Pakistan and Indonesia, because these are the 3-4 regional countries associated with Sri Lanka. And the perception about Sri Lanka, they had a feeling that, okay, you guys, being a small country, if you do the right things, you will bounce back. And that was our communication to them as well. So look here, so we are a nation. resilient nation, right? So going back in history, how we bounced back, also giving them confidence and reassurance that, this is a country that has a lot of substance, to work with. And I think that is very well established.
Given your overall experience curve of 30 years, could you tell us how do you see Sri Lanka shaping in the next 3 to 5 years?
1 year ago, what we had, the situation was like there was no visibility, and people really panicked, and people started moving out of Sri Lanka. A lot of brain drain also happened. I see if we do the right things, in the next 3 years, I'm sure, the situation is such that even IMF are, a critical watchdog, and they will also be ensuring that, we don't do the mistake of, taking wrong decisions. Politically and economically, if we do the right decisions, right, I think Sri Lanka as a nation, maybe we can go up to about double-digit growth in the next, third and fifth year. Actually, next 2-3 years is going to be like maybe it's more of a rebuilding, but 2027 to 2030 is going to be very good, is what our sense.
Azam, thank you so much for taking time off. One last question from me. These youngsters are working very hard. They're looking at Sri Lanka for a future for the next 10-15 years. What is your advice to a youngster doing the masters, just like you, looking at the future, but you also have a situation where our debt is at about $51 billion. There's so much of very poor leadership coming from the political hierarchy. What advice would you give a youngster?
See, larger scheme of things, if you look at, all the other countries also having trouble, right? When you say UK or any, every other country has their own share of problems. What I would suggest is, or what I would recommend is that try and do what you are good at, and have a little bit of patience and hope for the best. So basically, now, we will have the advantage of positive spillover from the countries like China and in India, because these two, and so we will be like the princes, because these two countries will, and maybe to great extent, US also will try and ensure that so we have the right platform. Politically, yes, we have concerns, but I think some good leader will emerge. That confidence and that hope you have to have. Probably the current leadership, I'm not a big fan of politics, but I can say from the interactions and conversations that we had with the different ministries, the last 10 to 12 months have been very objectively driven. So I don't know how long this will continue, but let's hope for the best, because what you out to gain in being in Sri Lanka is far greater than going out and trying to look for the greener pastures. Why I'm saying is that if you want what you want to achieve in life, if it is a holistically the full life, right, I think being in Sri Lanka is the best. But if your objective is to earn only money, of course there are places where you go and earn your money and then you can come back. So it's a very difficult question, and I don't have a clear answer. But this is what I see. being in Sri Lanka is going to throw in more opportunities, because as it is, Sri Lanka needs, people like you all, right? So you guys have, with great expectations, you all have got into this program, and you will continue to learn. And the companies are going to, very bullish, so some sectors, particularly agriculture, tourism, green energy, all these, sectors are, very bullish about the future, and they are planning for the next 5 years. So they need people like you all, to contribute for their growth.
There are two more questions that has come, which
Yes.
will shoot it out. Very, very interesting questions. Let me just. It says, what is the competitive advantage of Cipla, and how would you sustain it over time?
The competitive advantage of Cipla is, our economies of scale, right? So as a company, I think we are a large manufacturer, and we, as I told you at the beginning, we have 42 manufacturing facilities, all are US FDA approved facilities, quality and affordability, because quality and affordability does not come together in most circumstances. But Cipla, because of overall 8 years of experience, overall learning, we have learned to be competitive in terms of our manufacturing capabilities. So that is definitely going to help. And also, we also engage in a lot of research and development and new product development. So these are the things, will keep us ahead of competition. We always try to be ahead of the curve in all what we do. And that is, so that mindset is definitely helping Cipla. I'm sure that is going to continue.
There's another question, very, very interesting question, Azam. It says, what is your next plan for Cipla?
Yes. Cipla now, what we are looking at, we want to partner the localization projects, right? So we have some, very good quality local manufacturers. We want to partner with them and see how best we can support the local economy. And so that is one big time project that we are driving. And we also want to have certain inorganic growth by mergers and acquisitions. That is one area that we are working as well. I'm sure these two coming together with our existing portfolio, the next 3 years is going to be very exciting for Cipla in Sri Lanka.
Thank you very much, ladies and gentlemen. That is Azam Jaward, MD CEO, Cipla. It was fantastic speaking to you again. Amazing words of wisdom. I love the story of the hospital that is created when people have been, the whole medical fraternity has given their green light saying you can't do anything more with a person. That is a lovely piece of, and the second, of course, is that I love that whole point of saying if you want to lead a wholesome life, a whole life, Sri Lanka is the place. Thank you so much, Azam. Azam, it was fantastic being with you. And once again, I really like to thank you for taking time off. I mean, as at now, we know that youngsters are faced with a lot of challenges. And when a corporate spends time speaking to them, it also gets them going in terms of giving them a new strategy, new thinking, and how the business world looks at positivism when what we see on TV is total negativism. So Thank you so much, Azam. We'll catch up soon and appreciate sincerely. Thank you.
Thank you. And one comment from my side. Rohant, I think this is a very good thought process that you have, to bring industry people, to give the perspectives, and definitely that will, enlighten them and also give them direction. in bits and pieces, and all coming together, I'm sure it can add a lot of value. So thank you very much for the invitation, and it was great talking to the team here. Thank you very much.
Thanks, Azam.
Thank you. Cheers.